And so that kind of threw up some alarm bells for us in August, and we started monitoring and seeing an increase of cases.
Tonight, Delaware Public Health District is warning hand, foot, and mouth cases are on the rise across the county.
The highly contagious disease is mostly impacting children in schools and daycares. 10 TV's Carla Rogner looks at how to protect yourself and keep you and your family healthy.
Right now, according to the Delaware Public Health District, there are 9 outbreaks of hand, foot, and mouth disease across the county.
And we kind of chalked it up to like grumpy toddler. And we kind of went on with our day. And then around like 6 p.m., he got a fever of like 101.
Last weekend, Katie Terry took her 3-year-old to the doctor after he wasn't acting like his usual playful self.
So we show up to the appointment, they take his temperature, and it was 105.7, which is insanely high.
Once his fever subsided, a few small bumps showed up on his hands and feet.
First signs of hand, foot, and mouth might just be fussiness or fever. It usually does take a day or two after the onset of illness before the spots start to appear.
Pediatrician Dr. Tricia Lucine says anyone can get hand, foot, and mouth disease, but toddlers and babies are especially susceptible.
And so when kids are playing with each other, they're constantly rubbing their noses and sharing toys, and everything goes in the mouth. And so it does spread very rapidly in that age group.
She says hand, foot, and mouth will go away on its own, but can be uncomfortable. And it's important to make sure kids with the infection stay hydrated. According to the CDC, kids can go back to school and daycare once a fever subsides. But while this virus spreads, it's important to make sure kids wash their hands and to clean toys and surfaces. Terry says her son is finally starting to feel better, but it's been a hard week for her family.
Just like taking it seriously and also like respecting other families. Like if your kid is having symptoms, probably don't go to the Y. Probably skip the park today.
If you suspect your child has hand, foot, and mouth disease, the doctor says you don't necessarily need to take them in, but the health department asks that you let them know so they can continue to track outbreaks. Reporting in Delaware, Carla Rogner, 10 TV News.